Hello, I'm Dr. Jarrod Bagley, CEO and founder of Corrective Health. Have you or someone you know ever been diagnosed with neuropathy? This is one of the most common and concerning conditions we treat in our office, and it occurs when the nerves outside of the brain and spinal cord, known as the peripheral nervous system, are damaged. This is generally referred to as peripheral neuropathy, and it usually causes pain and numbness in the hands and feet, but it can also affect balance, which increases the risk of falls. Neuropathy affects both the motor nerves that control muscle movement and balance and the sensory nerves that detect sensations like cold or pain. But it's also possible for neuropathy to damage the autonomic nerves, which affects the internal organs like the heart, the bladder, the blood vessels, and the intestines. Now, in the United States, about 25 million people, including more than half of all diabetics, suffer from neuropathy. And for the overwhelming majority, the only solution they've been given is to take harmful medications for the rest of their life and to try and avoid amputation. Now, despite what you've been told, you don't have to deal with it for the rest of your life, nor is your only solution to take pain medications or gabapentin and other anti-seizure medications. You can actually reverse neuropathy, and you can do that without all of these dangerous medications. In this video, I wanted to talk about how neuropathy, or damage to the peripheral nerves, causes many different and distinct effects on the body. One of the common types of nerves affected are the large fibers. These are the nerves that are responsible for controlling balance and coordination and could lead to big problems if they aren't working properly. The biggest and most obvious problem here is an increase in falls when you lose balance and coordination. Now, we have millions of nerves in our feet and our legs that communicate with our brain for position sense. This is why you could close your eyes and still be able to hold your balance, because it's the nerves in your feet and legs that communicate with your brain. Now, when sensory nerves begin to die off, our position sense begins to fail. You may notice that when you try to get up from a seated position, you have to regain your balance before you get moving, or maybe you have noticed that you have to take shorter shuffle steps to walk, or even maybe you have to use things around the house to grab onto to keep from falling. This continues to get worse and worse until you need a walker to stabilize yourself. And falls are a big concern because they increase the risk of major injury. As a matter of fact, falls are the leading cause of injury death in people over 65. And we'll discuss later how you can actually restore balance and stability so that you can confidently do the activities that you may be missing out on without a walker or a cane. Another type of nerve that is affected in peripheral neuropathy is the small fiber nerves. These are the nerves that sense heat, pain, and sharp sensations. This also creates a major health problem when these nerves are damaged because, well, the people may not know when they have cuts or injured their hands or feet, which in turn leads to infection in those areas. Now, when you have damage to these fibers, you can suffer deep cuts or fractures in your hands or feet that you may never even realize that you ever had. And when these small fiber nerves are damaged, as in peripheral neuropathy, can also result in chronic symptoms like numbness or tingling, even sharp sensations or pinching and electric shock sensations as well. Another type of nerve that is affected by neuropathy is the C-fiber nerve. C-fiber nerves are the nerves that tell your brain the temperature of your hands and feet. If you have C-fiber damage, you may notice a burning sensation when your feet or hands are actually cold, or maybe even feel freezing pain when they're actually hot. When these nerve fibers are damaged, your brain can't detect if your hands or feet are too hot or too cold. The concern here is that patients can incur severe burns or even frostbite without even realizing it, which can result in far more damage. Now, because of the type of damage and the effects peripheral neuropathy has on the body, a multi-pronged approach is required to treat all damaged areas. And within our Corrective 360 process, we have a 4-part neuropathy reversal therapy regimen that has shown great results, each of which is just as important as the next in order to correct the problem. One of the therapies we use is low-level light therapy to stimulate angiogenesis. Angiogenesis is the creation of new blood vessels, and new blood vessels around a damaged area are exactly what the tissue needs to heal. These new blood vessels bring blood, nutrients, and oxygen to the nerve so that it can heal. Light therapy reduces pain, improves immune function, it speeds up wound healing, it speeds up fracture healing, and it increases the production of DNA and collagen, and increases the activity of fibroblasts, all of which are necessary for healing and wound repair.
Hello, I'm Joseph, the lead technician here at Corrective Health, and I want to talk to you about another therapy we use to reverse neuropathy naturally. It's called nerve reeducation. When nerves get sick and start dying off, they forget how to work properly. So we have to rehab them and teach them how to function properly again. We use the same technology that's being used in all the major cancer treatment centers in America. They use it because chemotherapy is also known to damage nerves. They get great results with it, and so do we. Our patients love it. We provide our patients with a cutting-edge digital electrotherapeutic stimulation device to take home. This way, the patient can perform daily treatments for constant therapy to retrain the nerves and reduce pain in the easiest, most efficient way, from home.
Hi, Robin here. I am the office manager and nutritional coach here at Corrective Health, and I'm going to be talking to you today a little bit more about peripheral neuropathy. As you heard in a previous video, neuropathy can be caused by blood restriction to the areas and they're not receiving the nutrients they need from the blood to those nerves to operate properly. One of the things that helps those blood vessels expand is nitric oxide. It acts as a vasodilator, expanding those teeny tiny blood vessels in the feet and hands, allowing those nutrients to get to it. If you're eating a lot of sugar or foods that convert into sugar, that is going to restrict that nitric oxide that your body produces, therefore causing those tiny blood vessels to wither up and not be able to get the proper nutrients to the nerves. So as part of our protocol here, our nutritional protocol, the third step that we do when treating neuropathy is we highly monitor the intake. We help coach our patients through what they should be eating, but we also are supplying them with nutrient-rich supplementation to help that nitric oxide produce so that those blood vessels begin to become healthy again, providing nutrients to the nerve endings and lessening that neuropathy.
Chiropractic adjustments are utilized within our clinic to improve communication between the peripheral nerves and the central nervous system. Our doctors are trained to correct subluxations or subluxation patterns in the spine that are interfering with the appropriate peripheral nerve signals to the hands and feet. A subluxation is simply defined as a vertebrae or spinal bone that's jarred out of its normal position and is caused by physical activities or habits or accidents, but typically a combination of all of these. This causes soft tissue damage around the joints of the spine, similar to when you sprain your ankle, and similarly it results in swelling. Now, studies show that all it takes to decrease nerve communication and affect function of a particular area of the body is the weight of a dime pressing on a nerve. So the inflammation from subluxated vertebrae far exceeds the amount of pressure required to result in nerve damage. The extent of the damage is determined by the amount of time this process has been going on. But research also tells us that we have to lose up to 40% function before our bodies alert us that something is wrong by symptoms such as neuropathy.
Hello, I'm Joseph, the technician and chiropractic assistant here at Corrective Health. And I want to talk to you about another therapy we use to reverse neuropathy naturally. It's called pulsed electromagnetic field therapy, or PEMF. PEMF is being hailed as an innovative treatment for diabetic neuropathy and has been shown to reduce pain intensity and improve sensation scores in patients with this type of neuropathy. PEMF acts like a supercharger for the cells. It helps the power factors of the cells, called the mitochondria, produce more energy, known as adenosine triphosphate, or ATP. The more ATP you produce, the more efficient the body is at increasing oxygenation, enhancing circulation, promoting hydration, facilitating detoxification, and gaining a better overall absorption of nutrients, all of which are seriously lacking in the diabetic population, as well as in immune-deficient post-chemotherapy patients, just to name a few. So whole body vibration is a natural therapy we use to treat neuropathy here in our office. And case studies show that it helps reduce pain, it helps improve mobility, as well as increase circulation, strengthen muscles and joints, improve balance, and increase vibration perception in neuropathy patients.
So if you'd like more information on how we reverse neuropathy naturally through our Corrective 360 process, and why medications aren't always the best answer, just get in touch with the office and we can get that info out to you. Also, please share this with others that you know that may be affected by debilitating symptoms of neuropathy, and be on the lookout for our next video to hear some of our patients speak about their experience in reversing their peripheral neuropathy naturally with our Corrective 360 process.
Well, I was suffering from a lot of, I guess they call it neuropathy. It was in my feet. Didn't have a lot of feeling. I'm a type 2 diabetic. I'd lost a lot of nerve pain in my feet, so I guess I did have feeling, but it was all pain. And that wasn't going away. I was taking medication for it, but still had a lot of pain and not a lot of circulation down in that area of my feet. I started taking prescription medication, but over time, things really just got worse. My biggest fear was that someday I'd probably wind up losing my legs. I first heard about the neuropathy program from my wife, who saw it online. My wife said, "You should do this." And so I decided to do it. The first week or so, I didn't really notice a lot. And then I started to notice that some of the darkness in my legs was clearing up, and my medical doctor said that would never happen. I was elated, really elated. I thought, hey, this stuff is working. Now I'm able to walk without pain. I'm able to work in my garden. I'm able to do a whole lot more than I used to be able to do. And that makes me feel fantastic. My name is Lonnie Schode. I'm a retired electronics engineer. I love to read, I love to garden, and I look forward to an amazing future.
After going to 2 other different places for treatment for my neuropathy, I came here. I decided this would be the place to come for treatment, which I've done. I'm about 90 to 95% cured, and I am very fortunate that I came here.
I came in with a severe neuropathy. I've been somewhat skeptical about coming here. I've been in the healthcare business for 45 years, but after increasing doses of gabapentin and having made no real progress, I came here. After 2 treatments, I was able to sleep at night. Very shortly after that, I was back to my neurologist, and he was so impressed that I reduced my gabapentin by half, and now I'm down to a quarter of what it was when I first started. Have seen continuing improvement in both my feet in terms of endurance, walking and standing.
And let me begin by saying that over 5 years ago, at the age of 80, I was told by a well-respected neurologist that I had peripheral neuropathy, and that at my age I probably had it for quite some time, and that there was nothing they could do for me other than to take B12 and be very careful that I do not fall over. Well, to my surprise, after testing, I thought that he could really have the potential of giving me some help. And here I am now in my 8th week of therapy, and the results have been amazing. I've no longer have the tingling and pain sensations in my feet. My balance has become just drastically improved, and on top of all of this, the greatest thing is that I'm sleeping better at nights. I wake up in the morning fully refreshed, and psychologically and mentally I'm just feeling a great deal significantly better.
I was having pretty bad neuropathy in both of my feet, and it was continuing to get worse after seeing the medical doctors. They really couldn't do anything for me. but give me some pain pills and some vitamin B12 shots, and it continued to get worse. And so I decided I need to do something about it, be proactive. And I saw the ad in the newspaper, so I came to get tested. And sure enough, I was in pretty bad shape. I have considerable improvement. I'm down to maybe 1 incident a week right now. I've only been coming for 3 weeks. I was having 5 or 6 incidents a day at the start, so it's helped a lot. The diet has helped a lot with the anti-inflammatory diet, the deflating diet. I've probably lost about 7 or 8 pounds already, and feel better, and have completely changed what I'm eating, because I was eating all the wrong stuff, and I've already cut back on some of my diabetic medications with seeing my doctor. It was okay. We did some blood work and stuff, and also on my GERD stuff, cut my Nexum in half already.
My feet have been dead for quite some time, and I got concerned because 2 different times in my pickup I had my foot on the accelerator instead of the brake, and I almost ran through the carport. So we started the treatments. About 3 to 4 weeks into the program, I noticed that after I'd done my home treatment, I could feel the carpet when I was walking. And that's the first time I've done that for quite some time. So continue to see improvements. I think I had only about 15% feeling in my feet when we started, and halfway through the program they checked me and I was up to 60%. So it's been very helpful. It's made me feel better, more confident in my driving, more confident in my walking.